The next section is on talking to you about Brooklyn as a microcosm of aging and health disparities in the United States. I say that because what we are experiencing here in Brooklyn is really what we are also seeing across the United States. And so it's very important for us to understand that we are seeing all of the problems that are plaguing the entire United States. And to some extent, I think also we are having more challenges than we face in other parts of the country. So the majority of Medicare beneficiaries in the United States are white, while about 24% are people of color. So right here, in terms of the cuts to Medicare, those are going to disproportionately impact, well, obviously those individuals that have less access, but in terms of just thinking about the people who are also going to be affected by Medicare cuts are also rural white Americans and white Americans in general. Large share of Black and Hispanic beneficiaries, more than their white counterparts, report relatively poor health across selected measures. And the selected measures here are also really, really important in terms of aging. So in terms of just characterizing their health as fair or poor, you see that both Black and Hispanics have a higher percentage. That also in terms of having limitations on ADLs. ADLs are a key component in terms of health and measuring health and well-being among older adults, a higher burden among Black and Hispanics. And in terms of cognitive impairment, we also see a higher burden among Black and Hispanics. So what's going on with our Brooklyn older adults? Brooklyn has the largest population of older adults, those individuals 80 and older, or what we call elderly. We typically in the Bridge program, we don't like to use the word senior or elderly. However, there are our older adults, and those are individuals who are 80 plus. These are the individuals that we rightly would call geriatric patients. 53% of Brooklyn older adults, 65 and plus, are minorities, racial and ethnic minorities. 36% are Black, 20% are Hispanic Latino, and 11% are Asian. 38% of older adults in Brooklyn are foreign-born. 33% live alone. That's a very high number. And more than 50% are dealing with some form of disability. A large portion of Brooklyn older adults live either near or in the poverty line. 53% have incomes below $20,000 compared to 43% of the rest of the city. And in our catchment zone here in near downstate, East New York, has the highest poverty rates, 30% in the borough compared to any other neighborhood in Brooklyn. Health disparities in Brooklyn, these are some old statistics, but we are in the process of actually trying to collect and generate a new information about health disparities and aging in Brooklyn. That will be forthcoming, but this statistic is coming from 2019, and in 2019, both heart disease and stroke were the leading cause of death and disability in Brooklyn. And 1 in 10 residents in the borough have diabetes, and Brooklyn also has the largest number of fall-related emergency visits and hospital admissions than any other borough in New York City. Not sure why, but this is something that we should explore in terms of housing or just health education. I'm not exactly sure. Disparities among older adults are also associated with race and ethnicity in Brooklyn. Older Blacks in Brooklyn have the highest hospitalization rates for heart disease, hypertension, and diabetes. Older Hispanics and Latinos in Brooklyn have highest rates for chronic bronchitis and asthma compared to other racial groups and other older Hispanics in other parts of the city. And then older Asians in Brooklyn although they have low overall rates of hospitalization for most diseases, but these rates are significantly higher compared to older Asians and all of the other boroughs.